Hello, and thanks everyone for joining us. Our special guest today is Dr. Amber Orman, who's a radiation oncologist with Advent Health. Correct title, is that correct, Dr. Orman?
Correct. Radiation oncologist and lifestyle medicine physician.
So we're going to talk about two different facets of treatment today. So let's start off with radiation because I got a lot of questions about that. And one person just asked to start with something really basic. When a patient is told that he or she needs radiation, what is radiation?
So radiation is one of the three modalities that we use to treat breast cancer. So we have surgery, chemotherapy, and radiation. And in breast cancer, radiation is used always after surgery. I should say almost always. There's always exceptions in life, as in medicine. But it's after surgery, so it's an adjuvant treatment, as we call it. And it's kind of used to clean up microscopic disease in the area, whether it be in the intact breast, if the patient had a lumpectomy, okay, so radiation and lumpectomy go hand in hand, or if there were disease in the lymph nodes, okay? And so what it is basically high energy light rays, okay? So typically we use photon treatment, and that's just really, really high energy light. So it passes in and out of the patient instantly. It does not stay in the patient, so you're not radioactive after this type of radiation that we typically deliver for breast cancer. And it just does that. It cleans up the microscopic disease, reduces your risk of recurrence, and often extends survival related to breast cancer.
And so how often will a patient, on average, need radiation?
Well, if a patient has had a lumpectomy, okay, radiation is almost always involved. If a patient has had a mastectomy, then there are some different situations where they would need radiation. So most of the time, if there's a lymph node involved, meaning that cancer has gone to the lymph node, then radiation will be used after any sort of surgery. When we are treating after a mastectomy, there's some other, factors that we look for: larger tumors, things that are higher grade, young patients, and so there's some other factors that come into that decision. And what we do is we look at the pathology report after surgery. We look at the initial stage of the patient when they first presented. Where was the disease? Did they get chemotherapy before surgery? What was their response to chemotherapy? So it's a pretty complex decision to make, but that's what they come and discuss with us, and we walk them through that.
And if a patient has radiation and then unfortunately has a recurrence of breast cancer, can that patient receive radiation again, or is this like a one-time deal?
That's actually a common misconception, and I hear that from my patients. They say, well, I thought I couldn't get it again, and we certainly don't want you to need radiation again, but in the event that you actually do need radiation again, you can get radiation again. And I've treated quite a few women with repeat irradiation, and it's tolerated well. It's not something that we take lightly, and we watch these patients very carefully, but certainly can be done if it's needed.
All right, let's move into something else that you are passionate about. I read an article and it mentioned evidence-based integrative therapies. So tell us what that means.
So I've always been passionate about nutrition, okay? And I started studying nutrition back in college when I was in engineering school. And so this has been a long time love of mine, just on a personal basis. But when I, started my medical career, went to medical school, I continued studying that, and in different ways. So when I was in my residency, I actually studied functional nutrition and functional medicine with a group of physicians. And then completed my residency and went out to my first job at Moffitt and really married the two. So I was, of course, talking to my patients about breast cancer radiation, but also talking to them about nutrition and, exercise and body weight and mindfulness and stress and sleep and relationships, all of these things. and making sure that we were using an integrative approach. So when we say integrative oncology, we are combining these things, which I call lifestyle medicine, with our conventional cancer treatments, so that you're getting the best of both worlds and better outcomes. More recently, I actually got board certified in lifestyle medicine. So this is a field of medicine now. It's called lifestyle medicine, and it's based on 6 pillars, okay, being plant predominant lifestyle, physical exercise, healthy relationships, avoidance of drugs, tobacco, alcohol, ways to mitigate stress, and improved sleep. And so these are the things that I really stress with my patients. And the radiation is certainly very important, and that is a part of our treatment. But when we bring these other things in, we see improved outcomes across the board, much healthier patients, much happier patients, and it often trickles down to their family and friends, so you're reaching other people, and that's what's absolutely wonderful about it.
Talk to us about, let's start with nutrition, because I think anyone who's gone through breast cancer treatment, we come out of that like, okay, I'm going to be healthy now, I'm only going to eat healthy things. So what does that mean? What should we be eating, and how important is the nutrition aspect of it?
So the nutrition is hugely important. And, if you are following a plant predominant lifestyle, meaning that you are eating mostly fruits and vegetables, beans, grains, nuts, and seeds, okay, and using other foods that are animal-based as more kind of side dishes or condiments, or eventually eliminating them, then the data shows that you can reduce your risk of recurrence by about 30 to 50%, depending on what study you are referring to. And this works both to prevent breast cancers in the first place and to prevent recurrence, okay? So I think the nutrition piece is the foundation, because once you're, getting used to eating a healthy diet and you're feeling good because you're putting good fuel into your body, okay? Because that's what food is. We often, it's a very emotional, behavioral, sentimental thing. We've got our family traditions, and grandma always makes this and that, and so it's a very touchy subject, and it involves behavioral change and changing traditions and all of these things. But if you get through those barriers and then you start to feel what it feels like to run on clean, healthy food all the time, then you really don't want to go back. Then you feel like moving your body more, then your body composition changes, and you're feeling, healthier and stronger and happier. Your gut microbiome changes, that can help your mood, so it has this trickle down effect. And what we really want is for you to become addicted to that lifestyle and not the standard American diet. And so that's our goal, and what we do in the clinic and what we do in our program called HEAL, we can talk about later, is we help patients get over that hump so that they can become passionate about lifestyle and really enjoy how they feel. And then it doesn't seem like, gosh, I have to make the decision to eat a salad today instead of a burger. This is, I just hate this, and I wish I could have the burger, but I can't. You want the salad, you want the fruit, so that's our goal.
And when people hear that, does this mean everybody should be going totally vegan?
No, it doesn't work for everybody. And that's, I always tell my patients, don't let perfection get in the way of progress. And so we want you eating more plants, okay? If I have to have one thing written on my tombstone, I think it's gonna be eat more plants, okay? That's our goal. We don't want you to do anything extreme, because that's not sustainable. Whatever you end up doing in terms of making progress has to work for you in your life. And if it's not working, you're not going to keep doing it. And so, people have kids, and they have picky husbands, and, all of the other people in their lives that might not want to do this. And that puts up roadblocks, or, you have certain reasons that you love certain foods, or maybe you have a medical reason that you feel like you can't go plant-based, whatever it is, we don't want everybody, or tell everybody you got to be completely plant-based. We just want you to eat more plants, because the more plants you eat, the healthier you will be.
And the other issue, when in terms of nutrition, we're not talking about food, but alcohol. We get asked that a lot. Should people who are trying to prevent breast cancer or avoid a recurrence abstain from all alcohol, like not even one glass a day or week?
Yeah, so you know, the counter argument is always, well, all of that resveratrol in the red wine is good for me. Well, if you eat red grapes, you're going to get much more of that. Just keep that in mind, okay? But the data shows any amount of alcohol will increase your risk of breast cancer, okay? Even one drink a day. So if you are somebody that wants to decrease your risk of getting breast cancer or decrease your risk of recurrence as much as possible, then you don't drink alcohol, okay? But that's not, you know, feasible for a lot of people. We want to drink once in a while. And so what I tell my patients is make it red wine, okay? Try to make it organic with no sulfites. You know, there are quite a few clean wines out there now. Keep it to, you know, the recommendation is one drink or less per day, okay? And eat it with antioxidant rich foods to combat some of the damage that alcohol is going to do. And so you want to eat it with, you know, dark berries, red peppers, dark leafy greens, things that are going to help you deal with that, you know, insult that you're introducing into your body. Okay.
All right, from there, let's talk about exercise. How does that play a role in prevention and recurrence? Because this is an issue where people commit to it in their mind, but then it's actually like doing it is a different story.
Yes, so exercise is incredibly important as well. I would say, you know, right underneath the nutrition is exercise. So it is also life-saving, okay? And the data shows that people that have, you know, habits, healthy habits in terms of exercise get less breast cancer, and it's about 30 to 40% less cases. People who start exercising after breast cancer diagnosis, okay, have a decreased risk of recurrence of about the same magnitude, and they will live longer, okay? Because when you're exercising on a regular basis, you're not just decreasing your risk of recurrence, but you're decreasing your risk of heart disease, which kills more people than all cancers combined. Okay, that's our number one killer in this country is heart disease. Right below it is cancer. So you're decreasing your risk of that. You're decreasing your risk of diabetes, of stroke, of Alzheimer's, all of these chronic diseases, you know, that kill many people in this country are benefited by all of this, by the entire lifestyle, by the nutrition and the exercise and everything, you know, combined. But what you want to do is 30 minutes a day, okay, of moderate intensity exercise. And what that means is you are, you know, walking fast enough or riding your bike fast enough or doing whatever it is that you're doing, some sort of cardiovascular exercise. You're moving quickly enough that you could not sing a song, but you can get out a few words here and there. Okay, that's moderate intensity. And then you also want on top of that 2 to 3 days per week of something for muscles. So you want some sort of strength training, and that can be body weight exercises like yoga or Pilates or, you know, push-ups on the wall and then push-ups on the, you know, kitchen table and then eventually push-ups on the floor. You know, so you want to do things for both your muscles and for, you know, cardiovascular activity. And those things combined give you the maximal benefit. And so it's just getting into that habit. You know, it takes people different amounts of time to change habits. But once you've reached that point where the exercise becomes a part of your day, okay, it's scheduled in, it's not compromisable, which is luckily where I've been for a long, long time. That's how I keep my sanity. I exercise every day. I just rode my bike 30 miles and I feel amazing right now. I need it, okay? So if I don't do it, I don't have a good day. It's like I didn't take my antidepressant. It's just part of my day. It's what I need. I feel good. My body feels good. My mind feels good. It's something that, you know, is very, very important to me. And so, but, you know, working that into your life can be very difficult because we can come up with many excuses. We don't have the time. We don't have the equipment. It's too hot, you know, whatever it is. And so taking those barriers down and making it part of your day is incredibly important, and you get huge benefits from that.
For those people who are currently going through treatment, they're looking at exercise like, I don't even have enough energy to get out of bed. What do they do?
Right. And, and sometimes you cannot do much. If you had a mastectomy yesterday, you're not going to be riding your bike the day after. There is a certain amount of downtime that is just, you just have to take it. But when you're able to get moving again, let's say, you're getting your chemotherapy and you're just so tired, but your blood counts are fine, you're not having any problems. It's just this fatigue, get out and walk, just move, get outside, get fresh air, walk slowly. You don't have to get to moderate intensity. You just want to start moving your body, changing your environment, getting outside. It's hugely beneficial to be outside in nature, and so we always encourage our patients, yes, I know you feel, awful right now. Maybe you've never felt this awful, but when you do feel like it's safe to get moving, you're just tired, but you're otherwise medically okay, then do it. It starts slow. Do not think you're going to be right back where you were, when you were CrossFitting every day or running 5 miles every morning or whatever, it was before. Just start slow, be patient with yourself, have compassion for yourself, and build from there.
And the other area, let's talk about, in the articles that I've read, you've talked about mindfulness. What does that mean?
Yeah, so mindfulness is hugely important. And I like to, I read a lot about mindfulness, okay? My bedside table has, books about, it's always nutrition or comprehensive lifestyle change or something about mindfulness or something about endurance athletes, okay? And the mindfulness books and the endurance athlete books they're always the same, okay? And I think mindfulness is the best definition I've read is mindlessness, okay? Mindfulness is quieting the mind or stopping the thoughts, okay? So our monkey mind, our wandering thoughts that are always there kind of distracting us from the here and now. And so a mindfulness practice to me can be anything. It does not have to be you in the lotus position, on a meditation pillow in the middle of a gorgeous room with no distractions. It can be like what I did this morning. I'm riding my bike, I'm focusing on the road and the sounds and the wind, and I'm keeping my mind present, okay? I'm not letting it worry about something that hasn't happened. I'm not letting it hope for something that hasn't happened. I'm not worrying about what happened yesterday. I'm just watching the road and I'm right there right now. And so I think mindfulness can be in the form of anything. A lot of my patients just like simple breathing exercises. If you can focus on the breath and shut your mind off for a few moments, the biochemical benefit of that is amazing. You can actually lower your cortisol levels by, deep breathing and, meditating, if you want to call it meditating, or just focusing on the breath and quieting the mind. It has vast, vast benefits. One of the things I read the other day, and I really liked it, mindfulness is about being present. So you're not worrying about the future. You're not living in the past. You're right here. But another lady put it, she said, hope is taking what you really want and making it seem unattainable, pushing it farther away. Gosh, I hope this happens. I hope I get the promotion, or I hope my mammogram comes out negative, or I hope, whatever it is. It's making it seem like, oh, it's never going to happen. And fear is taking what you don't want to happen and bringing it closer to you. So you're perseverating over it. You're fearful. You're thinking about it. And so that's something that I try to share with my patients, because there's a lot of anxiety about recurrence, and you're going in for the scans and waiting for the news, and you're hoping. I try to say, just, quiet the mind, focus on the here and the now, right here, right now, you're okay.
And how does that affect the physical body, especially for people who are going through treatment? Because a lot of times people will say, I don't want that negativity in my life because that's going to, not be good for me in terms of my treatment. So how does mindfulness affect the physical body?
Yeah, so when you are in a state of stress, you're chronically inflamed, okay? So the level of inflammation in your body has risen because you're emotionally stressed, okay? And things happen biochemically. Your cortisol is up, your immune system is doing things that it shouldn't really need to be doing. And so it's distracted dealing with all of this inflammation rather than focusing on what it needs to do, which is killing off cancer cells. So the mindfulness piece is hugely important, and if you're in a state of constant stress, then you're not really too interested in eating healthy, you're not interested in working out. And so sometimes that's the key to getting somebody, to accomplish these other changes that will benefit them, is working on the stress, okay? But sometimes when we work on the food and then, exercise, the stress goes down. And so they're all so intertwined.
Talk to us about acupuncture.
Acupuncture. So I love acupuncture personally. It's helped me with some old injuries from an old bike accident that I'm still living with, that'll never leave me. So it can help, muscular things. It can help nerve pain. Now, when you're specifically talking about cancer patients, it can be great for chemotherapy-induced peripheral neuropathy. Okay, so a lot of patients who get chemo, they'll finish their chemo and they've got, burning fingers and toes, and, they're not able to really walk as well as they were before. So they're having a lot of problems. Now, this takes a while to go away, but acupuncture can actually help it. Okay, there's good data behind it, and it can, help it go away quicker. It can help nausea as well. It can help anxiety in some patients, depression. So it's one of those things that has a lot of uses. But what you want to make sure is that you're going to a well-trained provider. Okay.
How do you find?
Yeah, so you want to do your homework. You want to make sure that they have, proper training. They display their certificates. Of course, they're using, single-use needles that they're removing from individual packages each time. The needles are incredibly small. Okay, a lot of people are like, oh, I hate needles, I can't do acupuncture. It's out of the question. But you don't feel it. It's not even like a little pinch. It's kind of just like a pressure. I would not want to watch somebody give me acupuncture. I don't want to see what I look like when I have all those needles sticking out of me. But I can tell you, it doesn't hurt. It just feels a little different. But afterwards, it's interesting. You really do feel better.
So let's bring this all to the point of the HEAL program. Tell us the goal of that and what is that all about?
So HEAL stands for Healthy Eating Active Lifestyle, okay? And this is something I've been working on for about 5 years. It's a huge passion of mine, and I'm so proud that we finally got this program up and running. So we have two kind of branches of HEAL. There's HEAL Breast, okay, so this is for breast cancer patients and survivors. And then there's a gynecologic division that one of my fabulous colleagues, Dr. McKenzie, runs. And so HEAL Breast, okay, it's an 8-week lifestyle immersion, okay, and we're currently using Zoom for obvious reasons. We found ourselves in the middle of a pandemic, so we had to kind of pivot and make it work. But it's actually been wonderful because we've been able to reach more people. And so what we do is for 90 minutes a week, we meet and we talk about different things. So we talk about plant-forward nutrition. We talk about physical exercise. We have a fabulous yoga session. We have a session on mindfulness. We have a life coaching session. And then there's a couple sessions just on kind of the general, why would you want to do this? Here's the data type of thing. And then a nice wrap-up, graduation session. And we've gotten wonderful feedback from our ladies. In fact, they don't want it to end at the end of the 8 weeks. So we've started doing alumni meetings once a month so that we can all still get together, because what they found is that these women become very close during this 8 weeks because they're sharing their experiences. we're setting goals every week, we're keeping each other accountable. And so you really go through this journey together and develop relationships. And so we want those to continue. So we're having little kind of brush up sessions where we'll introduce a new topic. We're going to talk about, natural skincare and things like this at our next topic, and just check in with everybody and kind of, keep everybody accountable and on track. And so it's been a wonderful thing. We are getting help from the Advent Health Foundation. So we have generous donors that will give money, and kind of earmark it for this program. So that's how, we help sponsor patients to go through the program. But if anybody wants more information about it, you can go to adventhealthcancerinstitute.com/heal-breast. Okay. We can probably put that in the comments.
And is this for current patients going through treatment, or those who have completed treatment, or anyone who's eligible?
Anyone, okay? So right now we focus on breast cancer patients, survivors. So if you've ever been diagnosed with breast cancer in your life, okay, this is for you. Now, some women say, well, I want to do this program because I want to get rid of my diabetes, or I want to, just be healthier. And so we are accepting other patients to the program. And I think at some point we'll kind of have a more general version of the program where we're not focusing so much on breast cancer and keep our breast cancer patients, together. But right now, while we're kind of in the pilot phase, this just launched in July, we're letting, anybody really that wants to come into the program, just as long as they understand that we will be talking about breast cancer. But it's so common. I mean, 1 in 8 women, so everybody benefits from this. And the beauty of it is that the content of the program works for anything, okay? All of our chronic diseases, the heart disease, the diabetes, the hypertension, the high cholesterol, the cancers, they're all due to lifestyle, by and large. A lot of our, well, I wouldn't say a lot, for in breast cancer, for example, 5 to 10% of our breast cancers are genetic, okay? So the vast majority are truly lifestyle, environmental related. And so it's a modifiable risk. And so anybody that's really interested in decreasing their risk of these things, or, helping them with lifestyle change, is certainly welcome to join.
And just out of curiosity, how did you reach this point where you got interested in all of this, other than just the standard treatment of surgery, chemotherapy, and radiation?
Yeah, so I grew up in the middle of nowhere in Indiana on a farm of sorts. We weren't farmers, but we would let people put their cows on our land, and as part of the treatment, we would get a cow every year. So we get this butchered cow, and we're eating this meat, and so it's, all grass-fed, hormone-free, free-range, organic. I don't know what other buzzwords there are now. I don't eat meat anymore, but it was, the premium meat. And so that was all fine. Didn't think anything of it. And I go to college and I get my whatever it was, I don't even remember what sort of meat it was, in the student dining hall. And I'm like, this does not taste like the stuff at home. And how could that be? Because beef is beef, right? It's all the same cow, but it's not. And so I thought, what the heck's going on? I want to learn more about nutrition. Clearly something is not right here, and I want to know why. And so I started learning about our food system, and then that spurred me, kind of led me in this direction of, gosh, there's some data showing that if we eat more plants, we're going to be healthier. And I was very stressed. I was at it's a very difficult program I was completing. I had to write the thesis to get my undergraduate education. I mean, it was not the easy path I chose. So I thought, I got to maximize what I'm doing here. And so started studying nutrition. I started changing my habits. And so I got away from chicken and dairy first, and I felt better. And then, I stopped the red meat, and I felt even better. And then eventually I stopped eating fish and eggs. And so I was having this personal journey along the way, and it was coinciding with my medical education. And so I just kept studying kind of independently and learning, gosh, we're not learning about nutrition in medical school. There was zero mention of any of this in my medical education. And so I kind of had this tandem thing going on, and I'm like, I got to, talk to my patients about this because it's hugely important. And that evolved into studying functional nutrition and integrative medicine at the University of Miami, where I did my residency. I worked that into my practice at Moffitt. And then when I joined Advent Health, developed HEAL based on lifestyle medicine, which I got board certified last year. So I was the third class to take the test. And so I thought, well, now I've got the credentials, I've got the street cred, I better develop this program. This is the time, because I've been doing it all along with my individual patients in my clinic. And that's great, but I don't have time to do it that way. It's not very efficient. I can't spend 2 hours with every new patient. And so we decided to make this a group experience. And I think it has absolutely been wonderful because I can reach more patients. The patients are getting healthy. The patients are meeting other people, especially now in this time when we're kind of socially isolated. This has been such a gift for so many people who are cooped up at home because they have basically, a weekly get together with their friends to look forward to now. And so it's just really, it's really been a nice time to launch it. And that was an unexpected perk, I guess, of this pandemic.
We have to look for the unexpected perks. So as we close, what is your, I call it the elevator speech, just your short, what do you want to say to patients about how important all of this is about diet, nutrition, and exercise and mindfulness in tandem with your traditional treatment? What's your message to patients?
I think that if you want to maximize the benefit you'll get from these treatments, which are not easy to go through, if you want to feel good while you're getting your treatments, if you want to decrease your comorbidities, meaning your other medical conditions, if you have them, diabetes, heart disease, whatever it might be. And if you want to live a longer, healthier, happier life, have a longer, what I like to call health span, then these things are invaluable. So eat more plants, move your body, try to reduce your stress. You can't remove stress, but we can help, we can find better ways to deal with it. Work on your sleep. Make sure you're maximizing, the people that you have in your life, surrounding yourself with healthy people that are supportive, and certainly, avoid risky substances. Okay, so it just comes down to those 6 things, and they sound very simple, but the impact is huge and so worth it.
Dr. Orman, thank you so much for joining us.
Thank you so much for having me.
You've given us our marching orders. So thanks very much.
My pleasure.